Good evening, everyone. March 11th, 2020, 1 year ago today.
This was when the first case of COVID-19 was identified in Monroe County. It was revealed to the public shortly after 11 that night. The following day marked the beginning of a battle for the public's health, our leaders grappling with the challenge before them.
As we've said here for a while now, it wasn't a matter of if, but when the virus would arrive here.
Parents, I ask that you keep your kids at home if they are sick. I want to report that the schools continue to have discussions about what they will be doing in the future weeks relative to events and assemblies and whether to close classes. Those decisions are ongoing, and we are having conversations with the superintendents on a very regular basis.
We understand that people are afraid at this point in time, and we recognize and acknowledge your fears, but we also, most of all, need your help.
And with this, our way of life changed. And 1 year later, we're still not entirely back to normal, but we are on our way and closer than ever before.
So tonight, we're going to examine the challenges, those behind us, those in front of us. Before we look ahead, though, let's look back. This comes from the Monroe County COVID-19 dashboard. The graph charts the number of new positive cases per day since mid-March of last year. Its peak was about 3.5 months ago, on New Year's Eve, where 838 new cases were confirmed that day alone. This reflects the COVID positivity rate in the county. The highest rate we saw, 18.6% back on April 1st of last year. And though we saw a notable decline over the summer, by December 27th, it was back to a frightening number, 12.7%. And this reflects the number of deaths per day in the county. At its peak, on December 20th, 25 lives were lost in a single day, all from the COVID-19 virus. Let's compare all of this to this month. As of today, our 7-day average of new cases was 118 per day. 5 people have died this month so far from the virus, and our positivity rate has dipped to 1.6%. While the pandemic is certainly not over, progress is being made.
Well, no one has felt this crisis more keenly than the healthcare workers in our hospitals. Scenes like this have played out all over the country. ICU wards and COVID units filled with patients, doctors and nurses doing everything they can to help them. Kevin Skardinsky is a respiratory therapist at Rochester General Hospital. Michaela Warner, a critical care nurse at Unity. Between them, they have more than 30 years on the job. On this 1-year anniversary, I asked them if their experience prepared them for the pandemic.
No, nothing good. Nothing good can prepare you for something like this.
The pure influx of people, the amount of death and dying, we're so exhausted and so strung out from the amount of patients that you have that you're not able to give the care that you would normally want to, and the time with the patients that you would normally want to. It was unparalleled to anything that I've encountered in my nursing career.
Local hospitals have been treating COVID patients every single day of the pandemic. The surge over the fall and winter filled ICUs to capacity.
Usually our ICU covers 18 patients only for the medical ICU. I think just in the ICU part alone, we are up over 25. May not sound like a lot, but when you're talking 25 of the sickest patients you've ever seen in your life, that makes it exponentially harder.
We were all just picking up slack. We were leaning on each other. We were sweating with each other, crying with each other. I think to some extent the mental aspect of COVID is going to last with, millions of Americans, of course, but especially the nursing and medical community for some time.
They saved lives, and often after weeks of care, they lost lives too.
I remember having them on a mask to help them breathe. And we were supplying 100% oxygen and as much pressure as we possibly could through this mask to keep them from being intubated. And he kept on asking when he was going to go home. The next day we had to put him on the ventilator. 2 weeks later, he was no longer with us. He kind of grabbed my hand and nodded, and that was it. That was the last interaction I was able to have with him. I told him it's going to be okay. It wasn't.
I have always kind of felt that death and dying can be a beautiful experience, and you should be let out of this world the same way you're brought in, and it should be a celebration and surrounded by family, friends, loved ones, and having that element taken away from people was just really hard. I mean, it went away, it goes against every nursing instinct that you have.
I'm going to keep on taking care of patients. COVID or otherwise, that's what I do. That's what all of us are here for, take care of patients. We didn't sign up for something like this, but we didn't back down either.
Kevin and Michaela both say they could not have gotten through the past year without their teams at work and their families at home. Both believe COVID-19 will be around for the unseeable future. Vaccine or not, they say, there are still plenty of people sick with COVID, and they will be there to take care of them.
Well, Maureen, that was remarkable. We owe so much to our frontline workers.